So how broadly do you define medical need?
It goes into financial health, social health. There's a large laundry list. What's important to me is the woman has to tell me that it's going to destroy her life if she can't carry the baby, if she has to carry the baby.
Typically.
Anti-abortionists accuse him of carrying out unnecessary late gestation abortions, a charge he vehemently denies.
What counts as a medical need, in your view? I mean, if the woman is really stressed about her pregnancy, how qualify her for
it has to get more to the point of depression, not just stress. And it fit within my confidence of what we could do safely, I would do that.
Right up until when? Late 38 weeks, 39 weeks?
I don't know.
That you're not comfortable saying?
No, I'm not going to say that. Yeah. To the fetus, it makes no difference whether it's born or not born. The baby has no input in this as far as I'm concerned.
But it's interesting that you use the word baby, because a lot of abortionists won't use that. They'll use the word fetus because they don't want to acknowledge that there's a life.
So I think that it is a baby, and I use it with the patients.
And you don't have a problem with
Absolutely
killing
not.
a baby?
I have no problem if it's in the mother's uterus.
It's wrong to kill an innocent human being, I agree. Abortion kills a human being, I agree. When I do an abortion, I am clear what she has asked me to do for her. I am clear that she's asked me to remove a fetus from her. I am clear that in your terms, it is intentional killing of a fetus.
So when you crush a human skull, it's not really gray matter, it's white brain matter that oozes out?
What's your point?
No, I'm asking you a question. Is the brain matter that oozes out when you crush a human skull white?
What does it matter? You've described what I do, so what is your point?
My point is that it intentionally kills an innocent human being. Would you concede the point?
I started my first concession was to your first two syllogisms, that abortion kills a human being. It is the intentional disruption of a pregnancy that kills a human being.
How many innocent human beings have you intentionally killed in your life's work?
I don't know. I don't measure my work.
Count.
I don't.
You've lost count.
If it's a million,
10,000?
20,000.
20,000?
What's the difference?
What's the difference
Yes, what's the
between
difference?
20,000 and 30,000?
Yes, no.
10,000 dead human beings.
Okay,
That's the difference.
okay.
Dr. Parsons does about 200 late abortions a year.
You open the neck of the womb as many millimetres as the patient is weeks pregnant. So if she's 10 weeks pregnant, you open it 10 millimetres. If she's 15 weeks pregnant, you open it 15 millimetres. It just, fortunately, it's nice and easy to remember, means that you can extract the fetus through that size of cervix at that gestation.
And when you've opened the cervix, how do you remove the fetus?
We use some forceps.
Bit by bit?
Bit by bit, yeah.
How do you feel about doing that?
Well, it's an unpleasant task because you see pieces of the fetal anatomy which are easy to recognise and therefore bring home to you what you're doing. As the gestation advances, the fetus becomes bigger and clearly is becoming more like a baby. They're less easy to remove from the womb, not just because of the size, but because they are more solid, so more force is needed to do it. But I always remember that what I'm doing is for the good of the woman, and that it is therefore justified, and therefore I'm willing to do it, even though I find it unpleasant.
To those people who believe that abortion is wrong, what you say and what you're willing to do will seem horrific. Is there any strength in the arguments that they have? Are they important? Are they valid?
I understand their arguments. I understand they're anxious about killing defenseless fetuses. I understand that completely. That's something that You have to if you're performing abortions.
Is that what you think you're doing? Killing defenceless fetuses?
Absolutely. But I regard the social situation of the woman as taking precedence over this potential life that we're destroying.
Is that the case?
That's overriding from my point of view.
Is that the case at all gestations, or is there a point, do you think, at which the rights, whatever they are, of the unborn child take precedence over those of the woman?
I certainly think that up to the legal limit that we're allowed to perform terminations, then the woman's rights are paramount. But as you get nearer those upper limits, it certainly becomes more difficult, I feel, to perform the procedures, because you do realise that the fetus could perhaps be viable if it was born alive.
While we did not keep statistics such as infections or bleeding, we only kept statistics on surgery. And 1 out of 500 women in the last 18 months had a hysterectomy, a colostomy, and 1 woman died. Now, we were careful to get her out of the clinic before she died, so we could always say no one had ever died there. Because that is a question women ask. Has anyone ever died here? We said no. And we told our staff nothing about the death. We didn't want them to be caught up in that. And when someone went to the hospital, we took them across town. An ambulance is terrible publicity in front of an abortion clinic. So we put them in my car, took them to a hospital where the staff and the hospital would help us in our cover-up. My doctor called in favors from other doctors. They falsified the records, and we did not show botched abortions. We had one woman who came in 22 weeks pregnant. We put her on the table. It was an in utero pregnancy. Everything was fine. We put her on the table. We put her on the table to examine her, and everything was fine. Moved her to another room for the late-term abortion. Now, my job was to hold that uterus for 2 of the abortions. It's the Hansen maneuver, and you tell him, okay, the head's here, the feet are here, the buttocks are here, and you actually move the baby down into the forceps. And the first time he went in, he pulled out placenta, which is normal. And the second time he went in, he perforated the uterus and pulled her bowel out. Think about that for a minute. That abortion is over on that table. You can't go back in there and pull more of her bowel through. He's missed the baby already. He has a hole in the uterus. We had to transport her to the hospital in my car. We had an IV started. She screamed the entire way. We got her to the back of the hospital in the emergency room, and one doctor came screaming out of the hospital, "I won't cover this one up for him, Carol. I will not cover this up." About that time, the doctor arrives, puts his arm around this doctor, and they're walking away, and the next thing I know, they come back, and they take the girl inside. They admit her, and after hours of surgery, the doctor comes out and tells me that it was an abdominal pregnancy. He tells me, as if I'm going to believe him, that that pregnancy was outside the uterus. That would have been, we would have been able to diagnose that in advance. We didn't, but that's what he told her. He took the baby, put it in a disposable drape, covered it up, and put it in the incinerator bag. And she walked out of that hospital with a colostomy and was told it was because it was an abnormal pregnancy, and it was not. I remember one doctor called me. I was actually outside the room, and they called me in and said, "This woman has a tumor at the back of her uterus, and I'm going to pull it off." And I thought, how can you pull a tumor off the back of a woman's uterus? It wasn't a tumor, Brad. He pulled her uterus wrong side out. And that woman had a hysterectomy because the doctor was too aggressive. Abortionists are not doctors. They don't save lives. They don't protect life. They take life. And they take lives in ways that you and I don't think of. Yes, they take the baby's life, but many times they take the woman's life because of their lack of standard of care.